What is up, guys? Welcome back to my channel. Today's video is going to be all about having an undersupply versus having an oversupply, the causes of these problems, the signs of these issues, and what you can do to fix these problems if you are having these struggles in your breastfeeding journey. And this video is part one of a series that I'm going to be doing on breastfeeding problems that you might have. So make sure you hit that subscribe button and the notification bell so you know as soon as the next video comes out. So without further ado, let's jump right into the video. So to start off, I just want to make sure you know that I am qualified to share this information. I am a mother of a 9-month-old. I have been exclusively breastfeeding from the beginning. I'm also a registered nurse, and I have made sure that everything that I am presenting in this video is evidence-based and approved by the Leche League. Most of the information is actually straight from their book, and I will link it below. So I just want you to know that everything I am sharing is backed up by research. So the first issue we're going to talk about today is undersupply. How do you know if you actually have an undersupply? Now, as moms, especially first-time moms, we don't have anything to compare our milk supply to. We don't have anything to compare our baby's, milestones to. So make sure you are really basing whether or not you think your baby has an undersupply off of your pediatrician's advice. If your pediatrician says your baby is gaining weight well, they have no concerns at all, please do not just assume you have an undersupply because you don't feel like your baby is getting enough milk. You want to go off of the evidence that you see. So if your baby is gaining weight, if they seem satisfied after they eat, do not worry about having an undersupply. However, if your pediatrician has said to you, your baby's not gaining weight as well as we would like, have you thought about supplementing either by pumping or with formula, then you might have an issue with an undersupply. Now, there are several causes of having an undersupply. It can be a hormonal issue, it can be a thyroid issue, but the percentage of those other causes is pretty small. So don't self-diagnose. Make sure you're running everything by your physician. But if you know you have some health problems, just know that could be a small factor in your ability to produce milk, and you might have to do some extra things to make sure you're making enough milk for your baby. But all of those other issues aside, the most common cause of having an undersupply is you are not feeding your baby often enough and long enough. With newborns, it's easy to think that they are satisfied every time they fall asleep at the breast. I think it's really difficult for newborns not to just automatically fall asleep at the breast. It's warm, it's cozy, it's the most perfect environment ever created. So if your baby falls asleep very easily at the breast, and they've only been nursing for a little while, make sure you are keeping them awake and ensuring that they are getting a good feeding in. Another thing you can do is try not to nurse your baby when they are sleepy. Try to be nursing your baby when they are awake. Get your good feedings in right after they wake up from a nap, when they are super alert and bright-eyed. You obviously should offer when they're sleepy as well, if that's how you like to put your baby down to sleep, but realize that that is more comfort nursing. It's not necessarily for caloric intake. Another thing to realize is that you should be offering to feed your baby very often, especially if your pediatrician has mentioned to you that you might need to start supplementing to help your baby's weight gain. Stop it! You may stop it. You want to get mommy's too first. Make sure you're offering basically as often as you can stand. And this will not be a forever issue, because remember, nursing is a supply versus a demand product. So if you are showing your body that there is a higher demand, it will start to produce more, and you will not have to constantly nurse every hour on the hour. But while you are trying to fix an undersupply, you want to make sure you are offering at the bare minimum, I would say every 2 hours. And if it's a newborn, I'd try to offer basically as often as they are willing to put your breast in your mouth, you should be offering. Another thing you can do is ask your physician, what are some good supplements I can take to help boost my milk supply? There's a host of things out there. I don't personally want to give you any recommendations. I have never tried any of them myself because I did not have that issue. So make sure you are asking your physician. You can ask your lactation consultant. Especially if you take any other medications regularly, make sure you check with your doctor and check that there will not be any weird interactions between your normal medications versus the supplements that you will be taking. So that is another option you can look into. The other thing you can do, especially if your baby has a really hard time latching, you don't want to risk your milk supply drying up. What you can do, of course, is to pump and then feed your baby the milk as you are pumping it in addition to the nursing that you were doing. And that is something that a lot of moms do very successfully. And even there are some moms who never get a good latch with their baby. It's always a struggle. It causes too much anxiety. So what they do instead is they pretty much pump full time. They'll pump, every 4 hours a day, roughly, and they'll just give their baby bottles, and it works out and it's fine. You are still really breastfeeding your baby. You're giving them breast milk, and you are doing the best thing you can for them. No, it might not be the perfect breastfeeding experience that you are hoping for, but remember, you are doing what is best for your situation with your baby. So if you're really struggling with breastfeeding in the beginning, make sure you watch my video about first-time mom breastfeeding experience and the common struggles that you're going to have, getting your expectations where they should be, and that will really help you to succeed in your breastfeeding journey. So that is everything I have about undersupply. So now let's jump into what it's like to have an oversupply, which is something I personally struggled with, and how you can fix it. We had to go get a snack, so she has her pears inside her little mesh Munchkin feeder bag, and I will link that below if y'all are interested. She absolutely loves this thing. But anyway, let's talk about having an oversupply. Sometimes you can give yourself an oversupply, which I think I did. I think I overpumped because I knew I was going to be going back to work. So I started pumping too much, I think. And again, that supply versus demand. My body thought I needed more than she was actually able to take in. And so I was making too much milk. However, I think a lot of moms can have an oversupply without there really being an underlying cause. It's just the way your body works. And the more children you have, actually, the more likely you are to have some issues with having an oversupply. So just know that even if you aren't having an issue with oversupply for your first child, it doesn't mean you might not have that problem later on with a second or third child. The signs of having an oversupply are actually pretty obvious. Some of the most classic would be your baby will start nursing like you're super hungry and then kind of arch back, pull back, act frustrated because the milk is coming out too fast. They'll pull off and there will literally be a little stream or a little spray of milk just shooting right into their face because that's how fast the milk is shooting into their mouth, and it's not easy for them to eat. Other issues that an oversupply can cause physiologically for a baby is basically when you're making a lot of milk, your breasts stay pretty full. And just like in raw milk that's not homogenized, the cream of the milk will rise to the top. So if you've heard the terms hind milk versus fore milk, the milk that you make is the same, period, all the time. However, your milk will separate if it's left for a long time and it is not completely emptied. If the baby is not nursing enough to suck all the milk out of your breast at every single feeding, or at least most of the milk out at every single feeding, the milk will start to separate and you will get that higher, fattier, creamier milk rising to the top of your breast versus the more sugar high milk that's full of a lot of lactose will come towards the front of your breast. So if you have an oversupply, your baby will start getting very lactose high milk. And the issue with that is that your baby does not produce enough lactase, the enzyme that is required to break down the lactose in your milk. They don't have enough of that to counteract if you have an oversupply, and it can cause them to get lots of bowel irritation. Specifically, she started having lime green poop. And I literally mean the color of the peel of a lime. It was that green. It was not like, oh, there was a slight green tint to her poop, which is completely normal for a breastfed baby, by the way. It was like, this is weird, this is wrong. It was lime green, it was foamy. She never had any blood, but that also can happen. And that's nothing to panic or freak out about if there's a small drop or two of blood in your baby's poop. Basically, that is just a sign of intestinal irritation for your baby, and you want to make sure your pediatrician is aware of that. Now, personally, when I told her pediatrician about the green poop, I didn't have a diaper to show to him at the time, so I don't think he realized quite how green I was describing, and he thought that it might just be a reaction to something I had been eating, which can obviously cause your baby to have diarrhea, so that's something to consider. But if you have poop that is the color that I'm going to show in this picture, it's likely that you might have an oversupply. Another thing that might happen to your baby is they will get the most horrendous rash of their life, and that is because there is just so much acidity and that type of diarrhea that it is just going to eat their skin alive. Other things you might notice is your baby doesn't act like they want to nurse, But if you pump a bottle and offer the bottle, they will jump on that bottle like they have not eaten in days. And that's what she would do. If I was ever gone and my husband was giving her a bottle, or if I was at work and my mom was giving her a bottle, she would eat like 20 ounces in a day. She would eat more than was normal, I would say, for a baby her age. So those are some signs that you can look out for and be aware of to see if you might have an oversupply. Now, what is the treatment for an oversupply? Well, again, it's the whole supply versus demand issue. It doesn't mean you're going to be offering to feed your baby any less frequently, but the method that you're going to go about it will be a little bit different. So what you are going to want to do is breastfeed on one side until it is bone dry, empty. And for me, that meant that I would feed on one side for half a day. I might only switch sides once or maybe twice a day. So I would feed on one side all morning, I would feed on one side all afternoon, and then I would switch to the other side for her night feedings. So I was lopsided for a little while, and I've kind of kept that strategy going since that time. So I've always made sure that before I switch to the other side, I make sure that the current breast is just empty, like there's nothing left in there. And that has kept me from having the same issue again, even if I need to pump for work or anything like that. Now, I know that I did actually have an oversupply because once I implemented this strategy, after 3-4 days, her poop started getting dramatically better. Her rash started to go away. Everything was so much better so quickly. I was actually kind of surprised. Now, my oversupply, I think, truly took several weeks to really go away, but she started getting a lot better because I was forcing her to eat one side, and so she was getting both the creamy milk and the lactose milk, and she was getting it all together, and she wasn't always leaving behind the fatty milk in my breast. So even if you think, well, I can't have that issue because I only feed on one side per feeding, I did that before as well, but I always switched at the next feeding. So I was always giving her the most full breast as opposed to giving her one breast until it was completely empty. So that's something you really want to look into. So if you're seeing any of the signs that I mentioned, you might have an oversupply. Just try that method to see if any of those things get better. There's nothing harmful that can happen from feeding your baby that way. And so just try and see if any of those symptoms start to clear up for your baby. All right, guys, so this one is exhausted, so I'm gonna go put her down for her nap. Make sure you hit the notification bell and hit the subscribe button because I will be putting out the next video talking about breastfeeding issues. We're gonna cover mastitis, plugged ducts, engorgement, etc. So if you're interested in any of those topics, make sure you stick around for the next video. All right, we'll see you later. Bye.